Well, it's time now for perspective. Months of various forms of COVID-19 lockdowns have forced families to be kept apart, caused social lives to be put on hold and pushed teaching online for millions of students. The social and psychological impact of the pandemic has been huge, with various studies showing that young people's mental health has suffered in particular. My guest today is Lynn Dolce, CEO for the Edgewood Center for Children and Families based in San Francisco. Thank you very much indeed for speaking to us here on France 24 today. What exactly are the specific things about the pandemic that young people you work with are finding most difficult?
Well, thank you so much for having me today. I think the young people we're working with here in San Francisco are really struggling with the lack of structure, the loss of being able to see their peers, isolation, loneliness, lack of extracurricular activities like sports or dance or anything that would bring them together for some exercise. And they're just really having a hard time spending so much time inside with their families, particularly for adolescents for whom, this is a time where they would normally be out with friends.
And how, in your experience, do these anxieties express themselves generally? Presumably there are lots of different ways in which these problems can manifest.
Yes, and I would say there's a variety of ways, but I think what we're seeing mostly is a higher level of acuity in kids that are reporting higher levels of depression, and some even with suicidal ideations or attempts. And before we talk more about that, I do want to say, though, that there are plenty of kids who are doing fine, even in the face of this isolation in school with peer pressure and bullying. And so for some kids, the result of the pandemic hasn't been all horrible. But I do think that for kids that were not having any problems before March of 2020, when the pandemic hit, we're hearing story after story of really serious depression and anxiety.
And what is it then that makes some students, some children, more resilient than others?
That's a really good question, and a lot of people have studied that for a lot of years. And I think stress is cumulative. So the pandemic has been stressful for so many of us. Let's say you're a family for whom you're having a hard time having food or finding shelter. If you add the COVID-19 on top of that, things get much worse for you. Or for instance, if you're a child or a family struggling with systemic racism, COVID-19 layered on top of that is going to make things really hard for you and your family. So resilience is really the capacity to cope with challenging things as they come. And I think kids that have had adversity in the past are maybe, unfortunately, sort of used to this. We see more resilience in kids that have been struggling with things in the past. And for kids for whom this is very new, they don't have a lot of experience with it. So also parental stress plays a big role in this. I think the economic downturn and the loss of jobs and the insecurity that parents are feeling sort of trickles down into the kids and the younger children as well. And so I think if parents can help kids find some things to be grateful for. Today was Thanksgiving here. We said a lot of gratitude and try to remember what we have that is positive. That is helpful when we're talking about resilience.
Now, you mentioned this
I think also.
sorry, I didn't mean to interrupt. I've got a slight lag on the line. We mentioned this a little bit earlier, the fact that teenagers at that particular point in their lives, they want to socialise, they want to break away from their parents. Just how important is it for young people, for teenagers in particular, to be able to forge their identities at that age?
Oh, it's really important. It's a time where lots of kids make a lot of mistakes, and it's the perfect time to make a mistake, right? Because you go out, you try something, you take a risk. Teenagers are born to take risks. Their brains are constantly challenging them with new and important information that they want to try out. The best time to take risks and fail is when you are with your family. You make a mistake, you come back, you learn from it, you've got people to support you through that failure. So teenagers are in a really hard place right now because they're not out doing those things. And they might even be home on their phones or on social media a little too much or in their rooms. If you're a family that is living in a place where you've got rooms with doors and you've got people in different rooms on their Zoom meetings or their Skype meetings for school, doors closed, it's very isolating even in the house because people are working from home and going to school from home. And so those opportunities for kids to go out there and, practice their identity, practice their autonomy, see what they like, see what they don't like. It's all been really truncated because of COVID-19 and the isolation and the shelter-in-place orders.
And of course, a lot of people have felt something of a sense of community online during this pandemic. Surely that can sometimes be a good thing.
I agree. I think it can be a good thing, but I think we knew even before COVID-19 hit that the online time that kids are spending it has to be moderated to a certain extent. There's no substitute for going outside and feeling the air on your skin and breathing clean air and seeing the leaves change in the fall. It's autumn now here. I think that three-dimensional life, that connection with other people in person is a very important aspect of all of our development and for all of our health. I also worry for kids for whom comparing themselves online, their body image. We are concerned about a burgeoning sense of eating disorders in young people. This is something that my colleagues at UCSF have been talking about and are concerned about as well.
So what help is available to young people, teenagers who at this time need help? What help's available that they might not necessarily be aware of right now?
Well, one thing is I would say to parents, please connect with your children. Knock on their door several times during the day. See if they're okay. Check in with them. Make some eye contact with them. Notice eating okay, if they're exercising, getting out just a little bit to, exercise their body, or if they're exercising too much too. I would say also that kids can, I know that it's hard when you're not in person to stop in at a teacher's office or go to the counseling center. Those are things that our kids are missing. They can't just knock on a door and have an adult that's not a parent accessible to them. However, if you're on school online and you do need help, I think the teachers are connected with mental health services and social services, and they can connect you with a counselor. I think that it's important to use any resource you can. Talk to a priest or a rabbi if you're connected in that way. I think when children or youth are talking to each other and you hear that suffering or is very upset or depressed, don't hesitate to tell an adult. I think that at this point, we really need to emphasize that our connection to everyone is so important, and we need more of it, not less of it. Don't be afraid to reach out and ask for help. I think when kids are doing that, they're reaching out for life, and they're reaching out for a lifeline. So we really need to be there to listen.
Lynn Dolce, I'm so sorry we're going to have to leave it there. Lynn Dolce is CEO of the Edgewood Center for Children and Families based in San Francisco. Thank you. A reminder now of the day's top story.